In the realm of medicine, surgery stands as a testament to human ingenuity, offering life-saving and life-altering interventions. Yet within this complex dance between precision and human fallibility, errors can occur. These errors are especially devastating when they involve operating on the wrong site, a stark reminder of the fragility of human life and the immense trust placed in medical professionals. The year 2007 witnessed a series of such errors at Rhode Island Hospital, shaking the medical community and the public alike. 3 wrong-site brain surgeries unfolded within the hospital's walls, highlighting a cascade of failures in communication, protocol adherence, and surgical safeguards. These incidents served as a harsh wake-up call, prompting a national conversation about surgical safety and the urgent need for robust preventative measures. The human cost of these errors was immeasurable, leaving patients and their families grappling with the physical and emotional toll of unnecessary procedures and prolonged suffering. The first incident in January 2007 involved an elderly patient in need of surgery on the right side of the brain. A surgical error, tragically, led to the procedure being performed on the left side. The consequences of this mistake were significant. The patient required a second, corrective surgery to address the initial error, adding further risk and complexity to their care. This initial incident should have served as a blaring alarm, prompting an immediate and thorough investigation into the hospital's surgical protocols and safety measures. The second wrong-site surgery occurred just months later in mid-2007. This time, the error stemmed from a misinterpretation of a CT scan. A patient presenting with a brain bleed was prepped for surgery. However, the surgical team, relying on the misinterpreted scan, drilled into the wrong side of the patient's skull. This critical error thankfully was caught mid-procedure, allowing for immediate corrective action. Despite the near miss, this second incident illustrated the persistent vulnerabilities within the hospital's surgical system. It underscored the need for clear communication among medical staff, emphasizing the critical role of accurate image interpretation in guiding surgical interventions. Yet, despite 2 alarming incidents, the hospital's response remained inadequate. It wasn't until the third wrong-site surgery in November 2007 that more comprehensive action was taken. In this third incident, surgeons again operated on the wrong side of a patient's head. The root cause lay in a confluence of errors, including confusion over surgical markings and a failure to conduct thorough pre-operative checks. This repeated failure to implement even the most basic safety checks exposed a systemic disregard for patient safety, raising serious concerns about the hospital's commitment to providing quality care. The aftermath of these 3 incidents was marked by a mixture of accountability, reform, and ongoing concern. Rhode Island Hospital faced severe scrutiny from regulatory bodies and the public alike. The hospital was fined $50,000 by the Rhode Island Department of Health, a penalty that, while significant, could not fully account for the harm inflicted upon the patients. The hospital also faced the daunting task of rebuilding trust with its patients and the community. In response to the mounting pressure, the hospital implemented a series of changes aimed at preventing future errors. One of the surgeons involved in the incidents was suspended, a step towards individual accountability. The hospital also overhauled its surgical protocols, introducing stricter guidelines for preoperative verification and communication. These changes, while long overdue, were a necessary step towards creating a safer surgical environment. However, the question remained, why did it take 3 devastating errors for meaningful change to occur? The wrong-site surgeries at Rhode Island Hospital were not isolated incidents. Sadly, similar errors have occurred in hospitals across the United States and around the world, highlighting the systemic nature of this problem. These recurring tragedies underscore the critical need for a paradigm shift in how we approach surgical safety. One crucial step towards preventing future errors is the widespread adoption and rigorous implementation of the Universal Protocol for Preventing Wrong Site, Wrong Procedure, and Wrong Person Surgery, developed by the U.S. Joint Commission. This protocol emphasizes a multi-step verification process, ensuring that all members of the surgical team are in agreement about the patient's identity, the planned procedure, and the surgical site. Beyond checklists and protocols, fostering a culture of safety within hospitals is paramount. This culture must prioritize open communication, encourage staff to speak up about concerns, and empower individuals at all levels to halt procedures if they identify a potential error. The events at Rhode Island Hospital serve as a stark reminder that even the most skilled medical professionals are fallible. By acknowledging this fallibility and implementing robust safety measures, we can strive to create a healthcare system where preventable errors become a relic of the past.